Okay, 2 minutes is up, so let's dive in. So today's session, I'm hoping we will keep to about an hour. It's broken up into 3 parts, so you're welcome to leave once we touch on some stuff that might not be as relevant to you. But what we'll discuss first are the changes that are being made that have come about as a result of some new funding that was introduced to shelters last summer. So these are minor changes in Outcome Tracker that will impact shelters to varying degrees. So we'll touch on those first. And then we will talk about just some minor changes that were made to a number of activities that shelters use for outcome measurement, that type of thing. And lastly, we'll touch on some more extensive changes to the PSI that again will affect some shelters more than others. So away we go. So I'll just remind those of you who haven't been on many webinars, the format that we're going to use today, your microphones will be muted. However, you can notify me if you have a question using the questions window. This is the question windows here. So you can type in a note if you have a microphone or are connected by phone and are able to share your question. You want to use your audio to share your question. Just shoot me a note saying I have a question and we can unmute your microphone and you can ask your question. Or if you prefer to just type the question into the question box and send it along, I can read it out loud and respond to it that way. So I'm going to take regular breaks just so the questions don't pile up too much. We do have about 26 people participating, so could get busy. And we'll also be recording this session and making it available to members. So stay tuned. Watch your email for any information that we circulate about this video being available to members, hopefully very soon. So here's an overview of what we'll touch on today. As I mentioned, we are going to touch on some data elements that were added for tracking new funding. So I will describe the data elements as well as their purpose, so why we're collecting them. I'll talk a little bit about the process that our data committee and our shelter directors went through to develop and implement them. I'll take you guys into Outcome Tracker, show you the new data elements, which should be in your site now. Tim is still working on adding all of these changes to your site, so you may or may not see them, but they should be available to you by Monday at the latest. And then we'll touch on any questions or concerns that come up about these new fields. So next I'll talk about how we've added the type of program to a number of activities, and again I'll touch on descriptions, reasons for the changes, and review what they look like in Outcome Tracker, as well as touch on your questions and concerns. And talk about the addition of percentile scores to the PSI. And I think this tool is used most often in second stage shelters, but there may be a few outreach programs and emergency shelters that are using this tool as well. So if you're interested in hearing more about those changes, please stay on. Okay, so the new data elements that were added to support tracking some of the new funding that has entered shelters over the last year. So we've added one new question to the calls contacts form. And this question is, was the caller provided a supported referral to another program offered by the shelter? And you have the option to respond yes or no to this question. And the second piece to this data element is adding the enrollment link to the residential and outreach follow-up adult intake forms. And what this enrollment link does is it allows you to choose from a list of call contacts that are associated with a woman's record and outcome tracker. You can choose the call contact that resulted in the woman's admission to that program. So for instance, if she phoned on a specific date, wasn't able to enter shelter, but was connected with somebody in outreach and then admitted, the person completing the outreach intake can link back to that call contact that initially referred her to the outreach program. So a little thing to note with this data element, and we'll talk about it a little bit more when we do the tour of Outcome Tracker, but In order for this linking to happen, both the call contact and the intake form have to be entered in the same record and outcome tracker, so basically under the same woman's record, under her name. So if her call contact is recorded under an anonymous call record, we can't link her intake into a program back to the call contact that was entered anonymously. So the reason for these new data elements, we did quite a bit of work to sort of understand, so this was with the data committee and with ACWS staff, is to really understand what the purpose of this funding was. And ultimately, it was identified that the funding was intended to increase shelter capacity where needed to better serve women and children. And shelters were given a lot of autonomy to decide how they use that funding and in what programs. So they weren't given a very specific use for the funding. They had the option to implement it in any number of programs, and as a result, tracking this information isn't as simple as creating a new program and outcome tracker because of the variety of ways that shelters have ended up using the money. But our thinking was that it did make sense to allow shelters and ACWS the option to link initial contacts made with women and their families over a helpline or a crisis call line to their eventual admissions to any programs offered by shelter. So that's ultimately what we're trying to do, is to start weaving together that picture of, okay, so our overall capacity has probably been increased with this funding, and what does that look like in terms of women requesting service and women actually receiving service once they're admitted to a program. It is important to note at this time, this is not a set of questions that are reported to HS. So HS has not indicated that they want this data. You are not required to include this data in your monthly data submissions to Human Services. This is really something we're implementing because we see its value for the network, and how that evolves in terms of reporting kind of remains to be seen, but you will be kept up to date of any changes to reporting requirements that come about in our conversations with Human Services. So just so you know a little bit, I think it's helpful to know how we developed these data elements. So some of you may remember in December of this year, so December 2015, we surveyed members about the use of new funding. They responded to a number of questions, and that's when we really identified just how diverse the implementation of the new funding has been. So many shelters are using it for new or existing roles in shelter. Some have directed that money to staff and outreach follow-up as well. So there's a number of places where we'll probably see that increase in capacity as well. So following that survey, the data committee, so we have a number of shelter directors who sit on a data committee. They met several times to discuss the different ways that we could start to look at this relationship and this elevated capacity without being too disruptive to how shelters are already collecting data for their program. So we wanted kind of a low impact way of starting to collect some more information without asking too much of shelter staff at this time as things evolve. And then finally, on March 3rd, shelter directors approved the changes at a meeting in Edmonton. So we're now rolling out the changes that were approved at that meeting. So I'm going to switch over to Outcome Tracker now, take you through the data entry process with these new fields in Outcome Tracker in a couple of different scenarios, just to sort of show you kind of how they're intended to be used. So hopefully this is helpful. Okay, so here is the People Organizations tab in Outcome Tracker. I have filtered a search on callers for myself. And our first scenario is with Betty Boop. So I'm going to open up Betty Boop's record. and go to the call contacts form. So this is where that initial field that we discussed, the was caller provided a supported referral to another program offered by Shelter, is entered. So I've already completed a call contact for Betty. You'll notice that under type of request here, I've selected residential admission request. So in this scenario, Betty has sought shelter services. She was unable to be accommodated due to capacity at the shelter. She and her 3 children, I indicated somewhere she has 3 children. Oh, there it is, number of dependent children. The shelter just didn't have space to accommodate her family size. And so I'm then asked as a staff person to complete whether she was provided a supported referral to another program offered by the shelter. So we couldn't accommodate her in shelter, but that doesn't mean that we're not offering her other services. And in this case, we're going to connect her to our outreach follow-up program. So you'll notice a little blue question mark here next to this field. If you hover over it, we've provided a definition to help staff in answering this question. So you'll see that supported referral means that staff receiving the call is actively involved in the referral by making a direct connection with the receiving program. So the program that Betty will eventually be admitted to worked directly with the staff who answered her crisis call, and they collaborated to eventually serve her in the outreach program. So now I will go to the outreach follow-up intake form. So Betty has been admitted to outreach follow-up. And the form is much the same. The only difference we have down here at the bottom is this enrollment link. And you'll notice another one of these question marks. So if I hover over this question mark, I'm given an instruction to link to the call contact that resulted in her admission to this program. So if I click on this drop-down list, I only have one option. So Betty has only made one call to the shelter. But I'm looking for the date of the call and the staff person who was involved in referring Betty to the outreach program. And then I hit save. So essentially what we're tracking here is women who could not be accommodated by shelter, so women who would essentially be a turnaway, but who are not necessarily turned away from services and are given other services, so we can start to make that link. So our second scenario is Marge Simpson, and Marge Simpson was involved in a crisis call, so she phoned the shelter for crisis support. Let's find her. There she is. So we'll go back to the Call Contacts tab, the first point of contact. And we will scroll down to that type of request question again. So was the caller provided a supported referral? This question is set to appear anytime a residential admission request, an information request, a crisis support call, or another call is selected from the type of request dropdown. So we want to capture this information broadly, not just for turnaways. And so I just want to point that out, that that's important. So in the case of a crisis support call, we will still be asked to complete the question, was caller provided a supported referral to another program offered by the shelter? And again, we can hover to access more information about what we're trying to collect with this question. We've indicated yes from the yes/no dropdown. And we can hit save and move on to her intake form. So in this case, down at the bottom with the enrollment link question, you'll notice that there are a number of crisis calls that Marge has made to the shelter, and so it'll be important for staff to be diligent to just check that they are choosing the right call contact. So again, looking at the staff name who received the call and was involved in the referral, and the date of the call, which is April 9th, 2016. Okay. So I have created a report just to kind of show you sort of how these two questions are working together to give us a bit more information about supported referrals and their relationship to admissions to programs. So we'll go to the Reports tab, which I have open up here. I've added this report into two folders, so I have it, if we go to Queries and Reports by Form or Activity. Because this query pulls information from both a call contact form and an intake form, I've added the query to both folders. So in the call contact form, you'll see that there's a report here, or a query now called Admissions Resulting from a Supported Referral, filtered by type of program. And in the description, so this report pulls women admitted to a program within a date range. So it's filtering on their admission date, whose intake was linked to a call contact where a supported referral was provided. It's filtered on type of request, which is entered on the call contact, and type of program as it is entered on the intake form. So type of program is answered on both the call contact and the intake forms, but in this report, we're interested in the type of program that's entered on the intake form only. So if we go to the results, I can choose my program where the type of program that was indicated on the intake form here. So in this case, I'm only searching for outreach follow-up, but I have the option to choose many options from this list. And I have the option to choose a specific type of request or many from this list. So I'll just remind you again, we're not collecting this information on client-related calls, but all other types of calls or types of requests that supported referral question will appear for. And I will run this report for April 1st to today's date and hit go. And you'll see that my two calls are now linked. So my two admissions are now linked to their calls. So I see Betty Boop, I see her program admission date. I see the date that she received a supported referral to the program, and I can see the type of request that she made on that call. And the same for Marge. I have her program admission date, the date of her supported referral, and a type of request, which was crisis support. Okay. So just a few points I want to highlight before we touch on any questions that have come up for you. So just a reminder, the was caller provided field is answered for all types of requests except client-related calls. Calls documenting supported referrals must be entered under a woman's identifiable record in order for it to be linked to her intake form. So they have to have the same name and same system name ID in Outcome Tracker. And again, this data element is ACW requested and not required by Human Services. So you don't need this for your monthly reports at this point. And I just want to note, because I'm sure many of you are wondering, these changes are more relevant to some shelters than others, depending on how they've designed their outreach follow-up programs. So some outreach programs are not designed to serve women who are not served in shelter. They might be designed to serve only women who are currently in shelter or only women leaving shelter, and that's totally okay. Again, we recognize, and when we made the decision to implement something, we recognize that shelters have used their funding in a number of different ways, so this will not fit for everybody. If you're unsure about how to use these changes with your program, so if you just want to touch base and discuss it a little bit more, you can contact me at otsupport@acws.ca, and we can talk about what's specifically happening at your shelter and what how these changes affect you specifically. So Okay, so now it's question time. And I noticed some questions popping up. Just give me one moment to get organized here. Okay, I have a request to increase the font size. I can do that for Outcome Tracker in just a sec. Sorry about that. Okay, so I have a question here. If a request for admission call comes in and the caller is accepted into the residential program, would we still select yes under supported referral because we will continue to work with her then in the residential program? Absolutely. So I think it's really helpful that this is collected just in a standard way across all programs, so not just specifically outreach. So feel free, we added the change to both the residential intake forms. The enrollment link change is on both the residential intake and the outreach intake, so please do capture it on both. And then when we go to reporting, we can contextualize those admissions using filters that filter on type of program. So you don't have to worry about that on the data entry side. We'll worry about it on the reporting side in the reports that we design for you. So if the crisis worker fills out the call contact form, does the crisis worker fill out the outreach intake, or is that done by the outreach worker when she meets with the client? So I think that is flexible. So I think whatever works best for your shelter. If your outreach staff have already been completing the outreach intake, I think it makes sense for them to make that link back to the call contact rather than the crisis worker who received the call completing the intake form on behalf of the outreach worker. Does that make sense? Let me know if you want me to clarify, but I think maintaining your current data entry process as much as possible makes the most sense to me, but if you want any support around implementing some changes to make sure that this data is collected accurately, we can connect over email as well to work on that together. Is this field still required on OT if the client is admitted? Can a staff member still save a call contact without completing the field in this case? Yes. So forms can still be saved. This is just an ACWS requested field, so we don't actually require any questions formally on behalf of the network, but if your shelter has implemented something as required, or if you would like to make this required, that's totally up to you. But we won't require it in the same way that a formal reporting requirement would be set up in Outcome Tracker. So we can set it up. So the question here is, maybe it's already done, but is there a way to make the most recent enrollment date the default? So when you format your activities, you can format it so that the last entered, so in this case, for the enrollment link on the intake form, we can design it so that that question defaults to the most recent call contact that was entered for that woman. So that's definitely something that can be designed into Outcome Tracker as long as there's not a risk that a more recent call contact could be entered and that link would actually be incorrect. So that's just something to be mindful of. If you do want to set up those defaults, you just have to make sure that the last entered value for the call contact will always be the one that you want to link to. Otherwise, it's a bit safer to have staff go through the process of selecting the call contact that they want. So, can you still have an outreach admission without filling out the enrollment question if the outreach admission is the result of the residential program rather than the crisis call? Yes, definitely. So not all outreach admissions will be the result of a supported referral, and in those cases you don't have to worry. They won't be included in reports because the supported referral question won't be answered. They will just be a standard admission that you guys have already been completing. So In cases like that, you don't want to set the enrollment link to default to a call contact because there's no real relationship there between the last call contact and that admission. You'll just want to complete a standard admission and leave that enrollment link field blank. Okay, sorry, I've gone out of order here because we've got so many questions. Just one sec. Is it an issue if you click yes, they were referred and the client doesn't follow through with the referral? It is not an issue, so we can still capture that a supported referral was provided. We still want to know that that work was done by the support worker who takes the crisis call, but if it doesn't result in an admission, again, that link just won't be made, and we don't have to worry about any incorrect admission information entering into the system, but we do want to know, okay, well, staff still did go through the process of providing that supported referral. Okay, what about people who want space but do not meet mandate, i.e. people with mental health issues who call in but are not ready to have referrals or are already working with several agencies, so they have support from other agencies? So if you're not providing a supported referral to another one of your programs, then you can just indicate no on that question, so it's not relevant to that individual seeking support. If they're not appropriate for programs, you're not providing a referral, so just respond no in those cases. What is a supported referral versus a regular referral? If a staff member provides the contact information of our outreach, for instance, but does not necessarily ensure that the client gets in touch with them, does that count? So in consultation with the data committee, we kind of identified supported referral as that crisis worker being more involved than just providing a phone number. So they are, liaising directly with somebody in the outreach program to connect that woman to services. It's not necessarily providing a referral in the same way of, giving a list of other services that are available to them, but it's sort of, I guess, a warm handoff to another program, so a bit more of an advocated referral might be another word that could be used to describe supported. Is this going to be a new separate report to submit each month? No. We are not submitting this to Human Services. This is something that we're just introducing on the data collection side, and shelters who find it very useful will have reports available to them to, if they want to analyze that information, then it's available to them to do so. We do want to encourage shelter to just get into the habit of completing the data, because as a network we may want to, so directors might identify a desire to aggregate this information for other purposes, but this won't be for reporting purposes to funders at this point. If the staff contact another shelter for the client we don't have room for, is that still a turn away or is it a referral to another program? So for this question, we are only concerned with supported referrals to programs offered by your organization. So if you're referring to another shelter, that's not a supported referral in the sense that you are connecting them to another service at your organization, but you are actually directing them to another organization. So that would not be a supported referral for the purposes of this question. If several crisis calls have led to an eventual intake, does each crisis call have to be linked to the intake or only the most recent call? I think only the most recent call. We can only, so the enrollment link field, you can only choose one option from that drop-down. And I think the most recent crisis call, or the one, again, if the most recent one is the one that resulted in that connection being made between the crisis call staff person and the admission staff person, then that's the one that you want to choose. But I guess in cases if the referral happened earlier and a number of crisis calls followed, you might want to link to that earlier crisis call just to ensure that the data entered on the call contact where the supported referral was chosen as yes matches the admission to the program. So you run the risk, I guess, if a number of crisis calls happened after the fact and the supported referral wasn't indicated on those calls, then those two, that relationship won't be captured in the reports the way we design them. If the client already has a support worker in the community or other shelter, are we required to provide services as well? Duplication of services and complication. That question I am not as comfortable answering. So what I might do is consult. I'm going to make a note of it and consult with Irene and Carolyn and get back to you via email if that's all right. Sorry for the pause. I'm just writing that question down. Okay. If our shelter provides a support program in addition to our outreach program, and the data is recorded in a separate form, do you want us to include the enrollment link in that form as well? So that would be up to you. We can't, ACWS can't aggregate data that's entered in non-ACWS activities. So if you've designed a unique activity to collect data for another program, if you want to make that relationship between those admissions and call contacts, you're welcome to, but we won't be able to aggregate it in the same way unless it's on a standard ACWS activity. Now, if you've designed other forms out of the ACWS intake activity, that is definitely helpful to us if you want to add the question to that form as well and make that relationship. So that's totally up to the shelter. Okay, if a crisis worker makes a referral to outreach and then the outreach worker contacts the client for screening, would this not be the call contact resulting in admission rather than the original referral? So that sounds like a process that might be a little bit more shelter specific. So I don't think that the outreach worker contacting the woman to arrange an intake is the contact that results in admission from a point of view of connecting referrals and admissions. So it is technically a call contact for sure, but I think the contact that initially connects the woman to a service or the availability of services is the one that we're trying to link to. Let me know if you need me to clarify that. That one's a bit tricky. Okay, if the client already has a support worker in the community, okay, I've already answered that one, or we'll follow up on that one. Is there a way to have the referral in OT pop up to the outreach worker? So do you mean you would like to alert alert staff that there is a call contact there? That is a good question. There are a number of options, like things we could do to your forms to provide additional instruction to your staff. So I don't know that we could create a pop-up, but we could definitely, there are definitely some options to make it a little bit more obvious to staff if that's something you think would be helpful to ensure the data is collected. So why don't we follow up over email and we can talk about some of those options. And anyone else who's interested in those options can contact me at OT Support as well. And I'm just going to pause again to write this down. Okay. If we make a referral to the outreach worker, is the call under the role of caller or potential? Again, that's totally up to each shelter and how they use those roles. So some shelters use caller exclusively and some want to track admission requests as potential clients. So that is totally up to you. If you want to consult with me on the implications of choosing one or the other, we can do so over email, just to make sure that whatever changes you make or whatever role you choose doesn't impact your ability to report your calls accurately. Okay, regarding a supported referral, we still need some clarification. Is that applicable to a call that was actually connected to another program, like our ICM, versus just being put through to the ICM's voicemail, where they have not had a chance to actually talk to the ICM? That, I'm going to get a second opinion on that question as well and get back to you. I'm not sure. Because, I mean, the attempt was definitely made to provide that supported referral, but the staff wasn't available. So I'm just going to get clarification from Irene and Carolyn about what to do in those cases. Okay. That's it. That's all of our questions. So what I will do now then is you can continue to ask questions about these new fields. I'm sure a lot of questions will come up. You can either continue to enter them in the questions pop up here, or what we can do is connect again over email and just ensure that you have all the information you need to proceed with data entry if that's what, if that's what you need. So feel free to email or include them in the questions window. Okay, so the next set of changes we'll review, these are very minor changes. These are the addition of 2 pieces of information to a number of activities in Outcome Tracker. And what we've done is we've added the type of program field. So you'll recognize this field from the call contacts and the intake forms, etc. This question is the question that is used to filter your reports to human services if you report to human services. And it's also the standard question we use at ACWS to break down all of our numbers by emergency, second stage, and outreach follow-up programming. So we've added that field, as well as some help text on how to use the enrollment link fields to the following activities. We've added it to case notes, the danger assessment and DVSA, the goal attainment, which is primarily a second stage activity, the IESR, so the impact of events, I believe, the impact of events survey, the parenting stress index, the women's emergency shelter feedback survey, and the walking the path together DA. So the purpose for these changes, when these activities were originally designed into Outcome Tracker, they were primarily used by emergency shelters. We weren't collecting this data for a lot of other programming, but over the last 5 years or so, many programs have brought on outreach and second stage shelters and have decided to use these tools across those programs. And because many of these programs are serving the same women, we have gotten to the point that we need to be able to separate that data when we roll it up. So we want to be able to isolate danger assessments completed with outreach women, danger assessments completed with second stage women, and danger assessments completed with emergency shelter women, because these are different client groups and we expect different results for these groups. Yes. So we want you to have the ability to separate them, and we want to have the ability to aggregate them separately as well. And the reason why we are encouraging the use of the enrollment link field on these activities is because of the research value we've identified in linking survey responses and results to the demographic data that we collect at intake about the women we're serving. So for instance, there's a lot of value in understanding the types of abuse a woman reports and how that might be reflected in the total score she reports on her danger assessment, or the length of stay a woman's length of stay and the level of danger that's reported on her danger assessment. So those are just a couple of examples. So I'll just show you briefly, in Outcome Tracker, what these changes look like. So we'll go back to the activity list here for Marge. And if I enroll her in an activity, let's have a look at the danger assessment. So I will search for danger assessment. You'll see now that the type of program option is at the top of the survey. So we will choose emergency outreach follow-up in this case. She can complete the survey. And down at the very bottom, we have the enrollment link field. So if I hover over this question mark, again, we've got some help text to provide some instruction. Select the admission to the program for which this tool is being completed. So in this drop-down list, we have admitted on April 14th to the Outreach Follow-Up Program, and this is the admission that I want to link to. And I'll hit Update. So it's fairly straightforward. I will show you on the case notes as well. That's a form-based change that will affect all of you, but let me just move my GoToWebinar pop-up. So again, the type of program has just been added at the top. Because it's on a form, it can be set to default to one of these values. So if that's something that you would like to do, please contact me. So we will choose Emergency Outreach Follow-Up. And down at the bottom, we will find that link again to her April 14th admission and hit Save. So that's that. So I see one question here, and I'll give everybody, as I answer this question, please feel free to shoot any questions my way that you have about this minor change to these activities. So this question, when we get online requests for admissions, I respond with referral numbers as well as my call contact info. Is this a supported referral? I think in this case it's not a supported referral. I think if you were, if there was an ongoing conversation with someone, so if you were contacting them back and forth and directing them to specific services, that would be a supported referral. But I think just sending them information about the programs doesn't necessarily reflect that kind of warm cooperation between programs that we're trying to capture here. If we admit to outreach follow-up and do a referral, how do we choose a discharge date? If we admit to outreach follow-up. So do you mean the discharge date from another program? I'll just get you to clarify that one if you don't mind, what discharge date you're referring to. And in the meantime, I'm going to answer the next question. So the next question is, when we are doing case notes for children, can we link to a crisis call or admission as well? So you can certainly link to their admission. So children will have an admission to a program, and you can link to that admission. We don't complete call contacts for kids, but if they are, for instance, admitted with their moms, we can still link them to that call contact through their mom and through the relationships that are built into Outcome Tracker between moms and kids. So there's still that link there without having to directly link them to a crisis call. I hope that makes sense. For collection of data purposes, can we create a separate field that separates the outreach from the ICM? As they are both emergency outreach follow-up under type of program, but in our shelters, ours are separate programs. Yes, so if you guys want to add an additional way to break down different types of outreach, we can certainly work together on that. So why don't we connect over email, and we can talk about what options there are to break down different types of outreach in your site. Okay. Okay, so we have about 12 minutes left. We're still waiting for a clarification on one question, and clarification was on the discharge date that was being referred to. But while we wait for that clarification, I'm going to move on to discussing the changes to the PSI just in the interest of time, and we will circle back to any other questions that come up while I'm discussing that. Okay. So just a brief description of the changes to the PSI. So what we've done, there were a number of PSI subscores that were already in Outcome Tracker, and these were used or were intended to be used to record the raw scores that come from the PSI survey that's completed with women. So what we've done is we've changed the descriptions of those subscores to clearly label them as the raw scores. And then we've added a place for you to also enter the percentile scores. So there's sort of two sets of scores that happen on the PSI, and now you can enter them both into the activity. So the reason we made this change is because in our work with shelters, it's been identified that the percentile scores are more meaningful from the point of view of providing services to women. So it's the percentile scores that help you identify what services or interventions you would engage a woman in around parenting rather than the raw scores. And so that's why we've added that data there. So it's sort of to make the activity a little bit more friendly to frontline staff, as well as allowing us to aggregate scores the way we need to. So I'll just show you quickly in Outcome Tracker what the changes look like. And if you're not using the PSI, that's totally okay. This is, I think, used specifically by some shelters for certain projects, and then other shelters just have an interest in collecting it. So if you're not collecting it, it's not a requirement unless you're involved in a specific ACWS project. Okay. So here's the PSI. Just wait for it to pop up. Okay. So everything is essentially the same. We have the pre-post at the top, so you would choose your pre or your post. We've included the type of program, as we just discussed. And we now have a header here that says raw scores, and here is where you can enter the raw scores from the survey. So we have defensive responding, parental distress, parent-child dysfunctional interaction, and difficult child subscores, as well as the total stress raw score. And if you hover over this question mark, there's a reminder to add parental distress raw, like basically what subscores are added up in order to get your total score. And the same for the percentile scores, so parental distress, parent-child dysfunctional relationship or interaction, difficult child, and total percentile. And I just want to point out, in case you guys think there's an error, but defensive responding is only a raw score. It's not a percentile score on this survey, so that's why it's not included down here. And then once again, you have the option to link to an admission. And we'd like to encourage shelters to use the enrollment link. Okay. So I'm going to, that was very brief, I know. I'm going to return to answer some questions from here, And I see them piling up already. So, oh, I see. So discharge date. We have 2 phone calls, but they may not call again. We may not have a discharge call. That's a good question. I think that's another one for me to get a second opinion on, if that's okay. So I will follow up via email on that question. So thanks for your patience while I get back to you on that one. How do we capture youth outreach? Is this under child outreach or adult outreach when we do an admission and assign a role? So if the child is the direct recipient of outreach services, so they are the primary client being served or the primary individual being served, then we have the outreach follow-up child role and distinct forms for children receiving outreach. But we don't record children the same way we don't record children in outreach the same way we record children in residential. So children, a woman may be receiving outreach services and may have 2 children, but unless they are the primary individual receiving services, they're not entered under that outreach follow-up role. They're just recorded on the intake form as dependent children in the custody of the woman. So if you are referring to kids receiving direct outreach services, then there's the child role. And if you want any additional support around training to record that, just contact me at otsupport.ca, at ecws.ca. So clarification online response. We also connect via phone for support as ICM worker. They may not follow through with the referrals. Okay. Clarification of online response. Okay. Let's discuss that a little bit more. That does sound like a supported referral. I mean, if the person on the phone with an individual is directly involved in connecting them to a program and is not just giving them phone numbers to call, then I think that this would be the case of a supported referral. But maybe it's best for us to work this scenario out a little bit more over the phone just to be sure. So I'll make a note of that as well. Okay. We have been using case notes to enter the outreach activity. Should we be using call contact field to capture our outreach contacts? So you are using, I guess that is dependent on the design of your outreach program. If you have outreach clients and you are documenting contact you have with clients, then the case note is the appropriate place to record information about that contact. If these are non-clients, so they're not individuals receiving ongoing service, but these are people that you make contact with out in the community on maybe a one-off basis, then call contacts might be more appropriate. But I think it's helpful, again, to work that out a little bit more, in more detail over the phone. So I'll make a note to follow up with you and just be sure that we are on the same page. What is considered youth outreach? What age? That is a good question. I don't know that it is explicitly defined, but by, like, I don't know that we have a shared definition for what qualifies as youth outreach. So why don't we connect on that as well? So we can provide some more information if you'd like, but I don't think that we have established any age guidelines for youth outreach. So that would be something that your shelter could define a little bit more clearly, but we should review if that's a funded program and you might have some restrictions around age that are outlined in your contract. So we should discuss that a little bit further if you like, just to be sure. Okay. So the question is, are these changes being pushed through by VistaShare or should we make them ourselves? So VistaShare has made the changes. He's made them shelter by shelter to avoid any, in the past when they've tried to make sort of general changes across everybody's forms and activities, it's created some issues, but he went in site by site and added the fields. So have a look to see if they're there. He's not quite done all the changes yet. Tim said that they'd be done by Monday. So if they're not there, or if you're concerned about any impact they've had on your forms, just give me a shout and we can get that addressed right away. Okay. Would we admit to outreach follow-up if we only have one supportive connection with someone in the community? Would we admit to outreach follow-up? That's a good question again, and I think I'm going to get some input from, I don't have any frontline experience, so some of these questions I'm less comfortable answering, and outreach is, not that anything is very standard across shelters, but outreach is a very broad description for a lot of different programs, so I just want to make sure that I get some input from probably Susan and Irene before I answer that one, so I'm going to add that to the list. Okay. Okay, this is a great question. I think I am confusing ICM role with outreach follow-up. Is ICM outreach follow-up? So a lot of shelters have taken ICM. So in the contract with Human Services, pieces of the funding shelters received were described as intensive case management funding. But shelters were given a lot of flexibility in how they implemented it. And ICM, the way it's described in the contract, sounds a lot like outreach, or the outreach that a lot of shelters have been providing. And so many shelters have just carried on tracking those new staff people as just outreach follow-up staff people and not calling them anything specific, because it just kind of creates unnecessary confusion to call different staff in the same program something else. So a lot of shelters are using it, calling everything outreach follow-up, and that's great. That's no problem. If you want to track your ICM activities uniquely, so if you don't want to include it in your outreach tracking, then we can look at different options for you to track that information. But we're sort of, the impression we got from a lot of shelters was that it seemed unnecessary to design all new forms and all new tabs and roles around staff that were essentially doing the same thing as outreach. So it's really up to you how you want to proceed with either grouping those staff or separating them. So we can follow up over email if you want to make any changes to your site, okay? Okay. Okay, so it's 11:33 and we did it in an hour, which I was worried we would go over time, so I'm really glad we got through all the content. I want to thank you guys for taking an hour to discuss this with me. I know there's been a lot of uncertainty around these changes, and hopefully introducing them to your staff goes really smoothly, and we are here to support you with introducing them to your staff, so please contact me if I can be of any further assistance. You know the email, otsupport@acws.ca, and enjoy the rest of your day. I'll talk to you, many of you soon, I'm sure.